Todd Dunn here. This video is about Medicare Part D prescription drug coverage. What I'm going to do in this video is describe exactly what Medicare Part D is, say a little bit about how it works, and then spend some time explaining how to go about picking a Medicare Part D plan. So, what is Medicare Part D? Well, basically, Medicare Part D provides coverage for prescription drugs that are prescribed to you by your doctor that you get from a pharmacy and take at home on your own. Part D does not provide coverage for drugs that are administered to you by your doctor either in the office. Those drugs are covered by Medicare Part B. At a clinic or urgent care center, where the drugs are also covered by Medicare Part B. As an outpatient at the hospital, for example, if you had an infused therapy, those drugs are covered by Medicare Part B. Or as an inpatient in the hospital, when the drugs are covered by Medicare Part A. So, all Medicare Part D does is help you pay for the cost of prescription drugs that you get from the pharmacy and take on your own. So, let's look at Medicare Part D a little more closely. Before I start talking about the details of how it works, I do want to say that Medicare Part D is private insurance that is very highly regulated by Medicare in terms of how the program works and exactly what benefits have to be offered. But it is private insurance and you buy it from a private insurance company. Now let's look at how it works. Medicare Part D provides coverage in 3 stages. Stage 1, called the initial coverage stage, is the only stage in which there are differences between the coverages provided by different companies selling Medicare Part D policies. Stage 2, the coverage gap, or in the popular press, the donut hole, was initially, when the program was created, a gap where there was no coverage. But current law is gradually closing this gap and providing more and more coverage in the gap. The coverage you get in the coverage gap, though, is the same no matter who you buy your policy from. And finally, there is stage 3, which is called the catastrophic coverage stage. This kicks in when you get to very high expenditures and provides additional coverage. Again, Stage 3 catastrophic coverage is the same, independent of who you buy the plan from. So of the 3 stages, Stage 1 coverage will vary depending on the plan you buy, but stages 2 and 3 will not. Now let's look at Stage 1, the initial coverage stage, a little more closely. All of the numbers that I'm going to be giving for the rest of this talk are for the 2018 year. These numbers all change a little bit every year. They're adjusted for inflation and with changes in the law that governs Medicare Part D coverage. Stage 1, the initial coverage stage, extends from $0 of total drug cost to $3,750 of total drug cost. Total drug cost is defined as the total that you and your plan have paid for drugs. So if your plan pays $50 for a drug and your copay is $10, the total drug cost for that drug was $50 plus $10 or $60. Now, what do your costs include? First off, deductible. Not all plans have a deductible, but if they do have a deductible, the maximum deductible is $405 in 2018. Second, copays and co-insurance. Copays are fixed charges per prescription that you have to pay. So when you get a prescription from your doctor, if there's a copay, you go to the pharmacy and say your copay is $10. You pay $10 no matter how much the prescription costs. Then there's co-insurance. Co-insurance is a percentage of the cost of the drug. For most plans, that co-insurance percentage is going to run somewhere between 25 and 33 to 40% of the cost of the drug. And this is one of the things that varies between plans. Okay, copays and coinsurance definitely vary from plan to plan, and they also vary by the class of the drug. Drugs come in 4 classes called tiers. They're usually called 1, 2, and 3, and class 4, which is sometimes called specialty drugs. Now I'd like to say a little bit more about drug tiers and also a little bit about drug formularies. Okay, let's look at the 4 drug tiers, 1, 2, 3, and I'm going to refer to the 4th one as specialty. Tier 1 drugs are generic drugs, and they will have the lowest copay for any plan. Some plans further divide Tier 1 into what are called preferred generic drugs and just generic drugs, and may have an even lower copay for their preferred generic drugs than for generic drugs. Tiers 2 and 3 are brand name prescription drugs that are subdivided into preferred brand name drugs, where your plan has been able to make a deal with the drug supplier. That's Tier 2. And non-preferred drugs, where your plan does not have an arrangement for special pricing with the drug supplier, and these will have a higher copay. Specialty drugs, finally, are unique and very high-cost drugs, and these are the drugs where you'll have percentage co-insurance, which, as I said before, typically ranges between about 25 and 33%, and in a few cases up to 40%. Drugs for a CLL patient that will fall into this class are things like subcutaneous immunoglobulins that you inject yourself, ibrutinib, idelalisib, venetoclax, etc. These are pills that you might take. And finally, specialty drugs normally require a pre-approval from the insurer before you can get them. Okay, what's a formulary? Well, a formulary is a list of drugs put out by the drug plan that basically is the drugs that are covered by that plan. Formularies vary from plan to plan, so not all drugs are in the formulary for every Part D prescription drug plan, and formularies change from time to time. Normally, the changes are simply adding drugs to the formulary as new drugs are approved, but occasionally drugs are dropped from the formulary. So it's important that you take a look at the formulary for any plan to make sure that your drugs are covered. Because if a drug is not in the formulary for a plan, then it is not covered. You might be able to get some sort of compassionate coverage, but you would have to fight for that. That brings us to the coverage gap or donut hole. The coverage gap extends from the $3,750 that define the upper limit of Stage 1 coverage to a total out-of-pocket cost of $5,000. Unfortunately, out-of-pocket cost is a rather vague number because of the way it's defined. And how it's defined depends on the kind of drugs that you're taking. Basically, it's different for brand name drugs than it is for generic drugs. What it comes down to is, for brand name drugs, out-of-pocket cost is 85% of the total cost of the drug. So if you have a prescription that costs $500, it would be 85% of that. And that would, total cost of the drug is how much you pay as coinsurance or copay plus what the drug company pays toward the cost of the drug. For generic drugs, however, it's only 44% of the total cost of the drug. So for $100 worth of generic drugs, only $44 counts toward your total out-of-pocket cost. Consequently, it's very difficult to figure out exactly what the value in terms of total drug cost is for the top of the coverage gap. It depends on the mix of drugs that an individual is taking. Now, what about how much you pay, independent of total out-of-pocket costs? That too depends on whether you're dealing with brand name drugs or generic drugs. What it comes down to is, for brand name drugs, you will pay 35% of the plan's cost for the drug, including any dispensing fees. For generic drugs, you'll pay 44% of the plan's cost for the drug, including dispensing fees. So, going back to my $1,000 drug, if it's a brand name drug, you would pay 35% or $350, and to my $100 generic drug, you would pay 44% or $44. And what you pay is not the same as the amount that gets counted toward total out-of-pocket cost. Finally, there's the catastrophic coverage phase. Once you get out of the coverage gap, you enter what's called the catastrophic coverage phase. In this phase, you pay different amounts for generic and brand name drugs, and the amount you pay is as follows: $3.35 for each generic drug prescription, $8.35 for each brand name drug prescription, or, and this is very important, 5% of the plan's cost for the drug, whichever is greater. So if 5% of what your plan pays for the drug is more than $3.35 for a generic drug, you'll pay the 5%. And similarly, if that 5% is more than $8.35 for a brand name drug, you will pay the 5%. For expensive drugs like cancer drugs, this 5% can be very substantial. Furthermore, these amounts apply to each prescription. For specialty drugs, your prescriptions are usually only going to be 1 month at a time, so you'll have to pay the fee each month. For less expensive drugs, you might be able to get a prescription that lasts for 3 months, so you'll only pay the fee 4 times a year, as opposed to 12 times a year for a specialty drug. Now, I'm sure you might be a little bit confused by exactly how these Medicare Part D prescription drug plans work, so I'm going to run through a quick example for a cancer drug that a CLL, or chronic lymphocytic leukemia patient, might be taking. We'll say that the person is prescribed this drug on January 1st. This is an important consideration because everything I've just said about how the plan works left out one thing. The plan resets on January 1st of each year. So if you, for example, are going to be starting an expensive drug in December, it might be worthwhile to ask your doctor if you can push it back to January, because it'll save you a lot of money. Anyway, let's look at my example. I've chosen a drug called ibrutinib, which is used to treat chronic lymphocytic leukemia. It's a very expensive drug. It costs approximately $12,500 a month for the standard dosage of 3 pills a day. And this drug, because of its very high cost, is going to push you all the way into catastrophic coverage in the first month of the year, or January. So, what about Phase 1 coverage? I'm going to arbitrarily say that your plan has a 33% coinsurance for specialty drugs. That means that you are going to pay 33% of the cost of the drug. Your plan might also have a deductible. I've used a plan with the maximum deductible, $405. In that case, you pay $405 and then you pay 33% of the balance of $3,750, which is the top of coverage Phase 1, and $405 for a total cost during coverage Phase 1 of $1,508.85. In the coverage gap, you're going to pay 35% of the cost of the drug, which amounts to, until the total drug cost, out-of-pocket cost, gets to $5,000, which works out to $514.70. And then you go into catastrophic coverage, where this is a brand name drug, but you're not going to pay $8.35 a prescription. You're going to end up paying the 5% of the balance that's due on the first month, the $12,500 cost of the drug, minus the $3,750 from coverage Phase 1, and $1,250 divided by 0.85 for the coverage gap, which leaves you with a total cost out of pocket of $363.97. That $1,250 divided by 0.85 was a function of the way total out-of-pocket cost is calculated in the coverage gap. So what's that work out to? Works out to, in January, when you start the drug, you're going to pay $2,387.52 for this drug. If you started the drug in February, you'd pay the same amount if you hadn't purchased other drugs earlier in the year. Every month after the first month, you're going to pay 5% of the total cost, so 5% of $12,500, or $625. Over a 12-month year, that means this drug will cost you $9,262.52. This illustrates a very important aspect of Medicare Part D prescription drug coverage. That is, that there is no upper limit to the amount you will have to pay for drugs. Okay, now you have some idea of how Medicare Part D prescription drug coverage works. Let's talk a little bit more about coverage and premiums. Well, first off, all Medicare Part D prescription drug plans provide nationwide coverage. Doesn't matter where you live when you buy the plan, it's good everywhere in the United States. The plans all also provide the same basic coverage. In other words, all plans have the 3 coverage stages, and they're pretty much the same. The big difference is in Stage 1, where copays, coinsurance, and deductibles vary between plans. As I said, those variations only really apply to the initial coverage stage. There are lots of different plans, and that's one of the things that makes picking a Medicare Part D plan a little confusing. More expensive plans may offer additional benefits beyond what is required by Medicare. In other words, an inexpensive plan probably only offers base coverage that Medicare requires for a Part D plan, but a more expensive plan may offer some additional benefits. What they are depends on the plan. As a consequence of this, premiums vary widely For example, where I live, premiums for Medicare Part D drug plans range from $12.60 a month in 2018 to $148.80. If you're just buying prescription drugs, you'll find that the plans with higher premiums are not necessarily better than the cheaper plans. The benefits of the more expensive plans usually come in the add-ons that they provide, so you really need to look at those closely when picking a plan. So now I'm going to move on to a little bit about how you can pick a plan. Probably the best tool for comparing Medicare Part D prescription drug plans and making initial decisions about which plan you want to buy is the medicare.gov website. I'm going to walk you through how to use this website to get information about what plans are available to you in your area, and they do vary in availability geographically around the country, and also to find out the details of the plans. So it's very simple. 1. Go to medicare.gov. 2. Click on the blue tab that says Drug Coverage Part D. This is at the top center of the page. Once you've done that, click on the light blue tab that says Find Health and Drug Plans. That's on the left side of the second page. That'll take you to a page that asks for your zip code. So you enter your zip code and click the button that says Find Plans. This will then take you to a page that's going to ask you, things like how do you get your health coverage, original Medicare, etc. If you're buying a Part D plan, you get your health coverage from original Medicare, so you'll click that box, and then it'll ask you some questions about if you get extra assistance in paying for Medicare. You can answer that question. For most of us, the answer will be no. And then you click the box that says Continue to Plan Results. And this is going to take you to a page that asks you to enter the drugs that you take. Now, what you want to do is go through and enter the drugs that you take. You want to use the brand names for the drugs as much as possible. Unless they're generics, then you'll use the generic name for the drug. And you'll go through and enter each drug and enter the dosage that you take. And it's fairly self-explanatory, and you can just keep entering drugs until you're finished. But there is one thing: if you are a patient who has a disease like chronic lymphocytic leukemia, and you might be looking potentially at taking a very expensive drug sometime in the future, and that is that you should enter one of these drugs, these very expensive cancer drugs, as one of your drugs, so that you can get an idea of how much it's going to cost. Because the next step is going to tell you not only how much the drug will cost for each plan, but also whether or not the drug is covered by the plans. So you enter all your drugs, and when you finish that, you click the box that says My Drug List is Complete. Then it's going to ask you to enter pharmacies, and based on your zip code, it's going to give you a list of pharmacies. You can click whatever pharmacies you want, and then finally, when you've entered up to 3 pharmacies, click on Continue to Plan Results. Okay, we're getting close to the end. The next step is to check the box that says Prescription Drug Plans with Original Medicare, and then click on Continue to Plan Results. This is going to take you to a list of Part D drug plans available in your area. There might be quite a few. Initially, the page is only going to list 20 of them. If there's more than 20, up near the top of the list of prescription drug plans, there'll be a little spot that says List All, and you can click that and get all of them to show up on the page. Now, for each drug plan, This page is going to show you details like the monthly premium, if there's a deductible, what the co-pays and co-insurances are, and if the drugs that you entered are in the formulary for that plan. And finally, it will tell you a star rating for the plan from 1 to 5. Also, over on the left side of the screen for each plan, it's going to tell you the total cost of the drugs that you entered. And however, unless you're doing this in January or doing it during the annual open enrollment period, it's going to tell you the total cost for the remainder of the year starting at the month that you're doing this. So if you do it in February, it'll tell you the total cost from February 1st through December. If you want to see more details, you're going to have to use the Compare Plans option. Unfortunately, you can only compare up to 3 plans at a time. So look through the list, find the 3 plans that look most interesting to you. Don't worry about if you want to compare more than 3, we can do this repeatedly. Click those in the check boxes and then click the Compare Plans box. That'll take you to a page with a lot more detail about the plans, and also it will itemize your drug costs by drug and by month for the full calendar year. So it'll give you a very good idea of just how much everything is going to cost. And it'll break everything out, premiums, drug costs, etc. So this is a very powerful tool for picking plans. The one thing though that it doesn't tell you is if a plan has benefits beyond basic Medicare requirements. Okay, we're at the end, making the final decision. Once you've finished looking at medicare.gov, you should have narrowed yourself down to a few plans. I would strongly suggest that you have both some inexpensive plans and maybe 1 or 2 of the more expensive plans to consider. At this point, what you want to do is go to the websites for the individual plans. So you want to go to the company websites for those plans. Those websites will have all of the details for the individual plans. They will have information that is not on the medicare.gov site, in particular information about add-ons to the plans that might justify the higher cost of some of the plans. Some of the things that you might find are some details about specifics of coverage. For example, my plan splits Tier 1 generic drugs into preferred generics, which have very low copays, and non-preferred generics, which have higher copays. My plan also gives full coverage for generic drugs without paying the deductible. You won't find that information on the medicare.gov website. It'll only be on the plan website. So you have to go to the plan websites to get the final details. Once you've made your final decision, go back to medicare.gov, go through to the list of plans, and at the right-hand side of each plan, there's a little button that says Enroll. You can click that, and medicare.gov will walk you through the enrollment procedure. It's very simple. One other thing I want to say, when you're choosing a plan, it's pretty complex. You might make a mistake, might create some anxiety, but don't worry about it. This isn't a decision that is going to be with you for the rest of your life. You can change prescription drug plans every year during the open enrollment period in November and December. So this is not a final decision. You can revise it if you're not happy with the plan you chose. Okay, that wraps it up. I hope that I've made Medicare Part D prescription drug plans a little bit clearer, that I haven't just muddied the waters. If you liked this presentation, please give me a thumbs up and subscribe to my channel. I'd appreciate that. Thank you for your time.